into the stream. So for today, we will be doing the nasopharyngeal and oropharyngeal sectioning in the newborn. So first of all is we need to identify the patient. So identifying the patient is really important, and it is a newborn, of course. In the essential newborn care, identifying the patient is really important because there are chances that those babies are may papalit sa ibang parents. And next is we need to assess the sign and symptoms of the newborn. If these sign and symptoms are present in the newborn, of course we need to do the nasopharyngeal and oropharyngeal suctioning. If the patient or if the newborn is having difficulty in breathing, and if the newborn is having tachypnea, and also if the patient is having this presence of secretion during the after the delivery, is we need to do the nasopharyngeal and oropharyngeal suctioning. But if the newborn is breathing healthy, the World Health Organization is not advising to us to do the nasopharyngeal and oropharyngeal suctioning anymore. So next is to explain the procedure to the significant others. If there's anyone that is related to the newborn, except the mother, because there are chances that the mother is still in the operating room. So we need to explain the procedure to the significant others. Next is enumerate the equipment needed. It is to establish, to save time and effort. These are the equipments that needed in doing the nasopharyngeal and oropharyngeal suctioning. So first of all we need is, of course, the suction catheters with the appropriate size for the patient. And next is the suctioning source. Some of them are portable in the wall. Portable sources of suctioning that is in the wall. Next is gloves, lubricant, mask, and face shield. Nasopharyngeal and oropharyngeal is done because it is to remove any secretions that is present to the newborn. It is also to stimulate cough, and it is done to promote oxygenation and airway patency in the newborn. So preparation for face mask. Next is the face shield and the gloves. Okay, so next is to explain to the significant others about the procedure. So this is Mrs. Smith. She is the auntie of the newborn. So ma'am, we are doing this procedure, the nasopharyngeal and oropharyngeal suctioning, to provide good ventilation and airway patency to your knee, and also to remove any secretions that she aspirated. So let's go to the procedure. First of all is place the newborn into a semi-polar position and then assemble all the equipment needed. So I will be using the catheter in the size 8. We need to maintain the tip clean and sterile. Then we need to do the rule of the thumb. So the tip in their ears up to here in their face. Next is to lubricate the tip of the catheter. Okay. Then we will insert this to the nasopharyngeal first, to the nares of the newborn. And then provide the client's privacy by closing all the curtains and windows. And also, it is a newborn, so while doing the procedure, we need to ensure to provide warmness to the patient. So first, we need to hold the forehead of the newborn so that it's resistant, you can able to control it. Then assuming that I am inserting the catheter now, and then next is we need to attach this to the portable suction, and then suction it for 3 to 6 seconds only. After 3 to 6 seconds of suctioning, we will remove it, and then let the baby rest for 30 seconds before inserting again the nares, and also assess the secretion, the color and the odor of it, and then monitor the patient's ability to breathe. Next is after 30 seconds of rest, we need to if the patient is having difficulty in breathing, and if the baby has secretion, we need to insert again the catheter on the other nares. So assume that I am inserting again, then attach to the portable suction for 3 to 6 seconds. After 30 seconds, we need to suction also the oropharyngeal of the newborn. So assume that I am inserting also. This is my side ng mouth. Side insert. Then suction. And again, sa side. Dun sa ilalim or dun sa side ng top. Okay. Suction. Okay. Then, monitor the baby. After doing the oropharyngeal suctioning, we need to place the newborn in sink position. And next is to remove the gloves and hand wash. And next is to document all the data findings. Monitor and assess the newborn. If there's any presence of secretions, or if the patient is having difficulty in breathing again. And after the procedure, we will be having hand washing, and then document all these data findings and assess and monitor the newborn. That's all. Thank you for today.